All right, so we've returned to the scene of the crime in the rack behind you. 5 weeks ago, while doing some pull-ups, I injured myself. So if you take a look here at my biceps, you can see on the left, this is normal for me. On the right, there's quite a gap here. So when this happened, I actually pulled away part of the muscle from the tendon. I heard it, felt it. It hurt quite a lot at the time, but I did realize that I had not torn the tendon away from the bone, so I did not need surgery. From there, I undertook a very specific peptide protocol to help accelerate the soft tissue healing. Now, 5 weeks later, back working out, everything else is totally normal. I've started doing some direct bicep work with very light weights, and have healed, in my opinion, remarkably quickly. So if you'll stay tuned, we're going to walk you through the peptide protocol that we used, how these help in healing, and how this might apply for patients who have injuries or who are undergoing surgery. So you saw the injury, and now I wanted to talk through some of the compounds that I used during the healing process. The first is BPC 157, or body protection compound. This acts to assist in soft tissue repair by increasing blood supply and by releasing growth factors that bring cells and proteins into the area to help with healing. The second one is TB500. This is a derivative of something called thymosin beta 4 produced in your thymus. This also helps with cell proliferation and with attracting fibroblast, endothelial cells, and other healing cells to the site of injury. Now, these two are commonly used. These are the peanut butter and jelly of healing peptides. You'll always see these used together. Now, what I then added to that is something called GHKCU, or copper tripeptide. It does all of those things that BPC 157 and TB500 do, including modulating inflammation, increasing blood supply, but it also helps to drive collagen synthesis. This is particularly helpful for soft tissue healing, for healing skin wounds. A lot of patients will use this to help with their skin tone. It's especially popular in combination with these other two, used a lot, especially by women who have had large weight loss with some of the newer weight loss medications and may feel like they have skin issues or skin tone that could be improved. So those three were some of the main ones. The other two, tesmorelin and ipamorelin. These two in combination help to drive production of growth hormone. Growth hormone, again, involved in collagen synthesis and in muscle protein synthesis, helping to heal at the site of injury. The other things that these do is to protect the muscle from being catabolized or being broken down when it has to be immobilized after a soft tissue injury like I had. So you've got the combination of all these things that are all helping to push and concentrate these healing processes. So for me, somewhere around 2.5 to 3 weeks after this injury, I really stopped feeling like I was hurt or injured or limited. There was almost just a shift over a few days to where even within a few weeks after a pretty significant injury, I feel basically normal. Not lifting and loading exactly like I was before, but 5 weeks in and very, very healed, very far along the way to recovering from this. So where this translates for a lot of our patients is with acute injuries and also with surgeries. So people who have muscle or tendon or ligament tears, this can be helpful, but also people having elective orthopedic surgeries, joint replacements, rotator cuff repair, lumbar fusion, any type of plastic procedures, cosmetic surgery that require skin or soft tissue healing. All of these peptides can be beneficial. So that was what I did in this situation. That's some of the ways that these peptides can help augment healing for patients.